Here's something you might not know. Those studies telling us a glass of red wine a day is good for the heart, they might have been comparing moderate drinkers to the wrong group all along. The people in the non drinking category often included what researchers call sick quitters, people who'd already stopped drinking because their health was failing. So, of course, the moderate drinkers looked healthier. Today, we're untangling one of the most contradictory areas in medicine. Is there actually a safe level of alcohol? I've spent decades working in addiction medicine, and I can tell you, few topics generate more confusion than this one. Patients come to me all the time saying, "But doc, I thought a bit of red wine was supposed to be good for me." And look, I understand why. The observational data has been seductive. The Blue Zones research, those regions famous for longevity, found that people in places like Sardinia were drinking 1 to 2 glasses of wine daily with friends and food and living remarkably long lives. The 7 country study showed what looked like a J-shaped curve. Moderate drinkers had about 30% lower cardiovascular mortality than abstainers. And Sardinian Cononau wine, it contains 2 to 3 times the artery-friendly flavonoids of other wines. So what's the problem? Well, the problem is that newer research using more sophisticated methods tells a very different story. Mendelian randomisation studies, which use genetic variants to establish causal relationships rather than just associations, found no protective effect of low-level drinking on dementia. None. Instead, they found a straightforward linear relationship: more alcohol, more dementia risk. A 1 standard deviation increase in drinks per week corresponded to a 15% increase in dementia risk. And here's the kicker. The apparent U-shaped curve, where abstainers seemed to do worse, it's likely explained by reverse causation. People who went on to develop dementia were already drinking less in the years before diagnosis. Their brains were already changing. We were comparing healthy moderate drinkers to people who were already on a downward trajectory. So what does this mean practically? The Canadian guidance now frames alcohol risk as a continuum. There's no magic safe threshold, just degrees of risk. At 2 standard drinks or less per week, you're looking at low risk, about a 1 in 1,000 chance of alcohol-related premature death. Between 3 and 6 drinks weekly, that jumps to a moderate risk, about 1 in 100. And at 7 or more drinks per week, the risk climbs sharply with every additional drink. For context, the old Canadian guidelines of 15 drinks a week for men, under current modelling, that carried a risk level of up to 757 times higher than what we'd consider acceptable. Now, I want to be clear about what we do know causes harm. Alcohol is a confirmed carcinogen linked to at least 7 types of cancer, breast and colon being the most common. It's a risk factor for hypertension, heart failure, atrial fibrillation, and hemorrhagic stroke. It causes liver disease, and even moderate amounts can shrink the hippocampus, the part of your brain responsible for memory and reasoning. The pattern matters too. More than 2 standard drinks in a single occasion significantly increases your risk of injury, violence, and accidents, regardless of your weekly total. Here's your takeaway. If you don't drink, don't start for health benefits. There aren't any that stand up to rigorous analysis. If you do drink, less is genuinely better. Any reduction is beneficial, and many alcohol-related harms, liver function, blood pressure, even cancer risk, improve when you cut back. That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.